welcome to another episode of Discussions on the Couch. Today we have a very sensitive topic that I struggle with and you sometimes struggle with as well. Joining us today, we have a special guest, Esther, who is practicing in the field, and today's topic is on depression, which is a mental health illness. But before we get right into it, please follow us on all social media platforms at BaswellGH. Don't forget to comment, like, and share, and subscribe as well. So, Esther, welcome again.
Thank you.
All right, so what is depression and what are some of the causes of depression?
Okay, so depression is a mental health illness that is mainly characterized by persistent sad mood. So people with depression are usually not in their right state of mind. They are very sad most of the time, and some of them actually end up losing interest in the things that they actually used to enjoy. So for some people, they love sports, some people love music, but then when they are depressed, they actually withdraw socially and they tend to ignore the things that they actually like. Now, the funny thing is that in our society, we tend to ignore mental illnesses a lot. But when you look at some statistics, you actually realize that depression and then mental illnesses in general are actually topics that we need to pay a lot of attention to. You know, the WHO makes us understand that we have about 970 million people in the world suffering from mental illnesses. And then when we take productivity in the world, we have about $200 billion being lost every year because of depression. However, this is a topic that we tend to ignore so much, mainly because of ignorance, lack of awareness, and then the fear of stigmatization. Now, when we take depression, we can talk about major depressive disorder. There are types. You have major depressive disorder, and then there's a minor depressive disorder. Now, for the major one, these people have a severe form of depression. So they are sad always. Some of them even refuse to take their bath. Some of them will not eat. Some of them will not sleep. It's either they are not sleeping or they are sleeping too much, you know. And at the end of the day, it has an effect on their productivity. For the minor one, the psychiatrists will call it dysthymia. Now, for dysthymia, it's a very mild form of depression in that the person may be able to go about their duties a little bit, but then at some points, you know, the person is sad for, you know, if you take the 7 days in a week, maybe 5 days, the person is sad. You know, you meet the person, oh, how are you doing? The person's like, I'm managing. You know, the person is always negative. The person is not so sad, but at any time you ask the person anything, the person is very negative, and it goes on for a minimum of 2 years. They can say that this person has dysthymia or minor depressive disorder. Now, you asked about the causes. For causes of depression, you know, there are actually a lot. We can start by talking about genetic causes. Depression can actually run in families. For some families, you know, you may have a grandparent who suffer from depression. There may be your parents or maybe a sibling. It tells you they're also prone to depression, and so you should always get yourself checked regularly. You should see a psychologist. And then the thing is that once you're going to see a psychologist, people think that, oh, you're having psychosis, which is not supposed to be the case. Yes. So you should actually get yourself checked if you know it runs in your family. And then for some people too, when they have stressful life events, you know, when we say stressful life events, it could actually be positive or negative. In that someone may actually get a promotion at work, which is supposed to be a good thing. However, it is so overwhelming for the person that the person has a hormonal influx that actually makes the person depressed. You know, and somebody too could actually have a baby. Some mothers have a baby. This is actually supposed to be a good thing. Every woman is looking forward to have a baby at some point in her life. She has a baby, but then she may have postpartum depression. Some of them may actually be mild and then go away in like 2 weeks. But some mothers can actually end up with full-blown depression, and they may even want to kill the babies that they've had. Yes. So for depression, you know, there are so many causes. For some people too, they may have suffered abuse at some point in their lives, and then as they grow, they become depressed. Again, for people who are aging, depression is commonly seen in people who are older. And then for we females, unfortunately for us, we are more prone to depression than males. Females are twice, you know, as likely to have depression compared to men. So yes, we can talk about genetics, we can talk about stressful events, we can talk about age, we can talk about gender. That's for we the females. Those are the main causes of depression that we're talking about?
Depression. He said it's women are very prone to depression.
More prone to depression
More
than
prone,
men.
yeah, than men. And it's because of our hormones.
Not necessarily. I think that the reason why some of these things, are researches that are done. Sometimes you can't really place your hands on what exactly is making the women more depressed than men. But then researches are done over the years, and you realize that, okay, over the years, we've seen that more women come in with depression compared to men. And I'm sure we'd all testify that we women are, in quotes, more emotional than men.
Yeah.
We take a lot of things to heart than the men actually do.
Yeah.
Yes, and so that could actually be the reason why we have more women being depressed compared to men. Yeah.
Okay.
Then with regards to the genetic cause, I'm just wondering, could it also be because of the environment the person grew up in?
Okay, so with genetics actually predisposes the person. So if you have a genetic predisposition, your environment may be okay, but you may still end up with a depression. However, the environment is usually like a trigger. For some people, the genetics may be there, but then if the environment is also a place that is, sort of fueling the depression, it could actually happen earlier than it's supposed to happen. So for people with genetic predisposition, usually it's like, irrespective of the environment you live in, you actually have a chance of having a depression. You may have a very good family, very supportive, you have a very good life, but because of the genetics, there are neurotransmitters in our bodies that are supposed to regulate our mood and then how we behave. However, sometimes these neurotransmitters get depleted in your body, so their levels go down. So if you have, say, your serotonin, your noradrenaline, or your dopamine levels going very down, because you have a genetic predisposition, then it means that even if your environment is okay, you could actually end up with a depression. However, somebody too may have genetic predisposition, and then their depression may come later because the environment in which they find themselves is a very good environment. Whereas another person will also have genetic predisposition, but their depression is going to happen early because the environment in which they find themselves is not very supportive, and then it sort of triggers a depression earlier.
What are some of the symptoms of depression?
Okay, so for symptoms of depression, usually for a lot of psychologists, they work with a classification system that the American Psychiatric Association came up with. It's called the DSM-5. That's Diagnostic and Statistical Manual for Mental Disorders. So for the DSM-5, it states that you need at least 5 symptoms to say somebody has depression. Now, 2 of these symptoms are always constant. The first is the person is always having a depressed mood. And then the second is lots of interest in things that they used to enjoy. So now if these 2 are present, then there are other symptoms. The other symptoms that you can talk about are weight gain or weight loss. So if the person is either gaining or losing weight, which is greater than 5% of their body weight in a month or every month, you are gaining more than 5% of your body weight, or you are losing more than 5% of your body weight every month consistently. Plus, you are always sad. You've lost interest in the things that you do. Some people too will have insomnia, or they will not be able to sleep. Some other people have hypersomnia, they'll be sleeping too much. Some people have decreased libido. Some people, the symptoms are a lot. But then the first 2 always have to be there. And then for DSM-5, it says that these symptoms should be present consistently for 2 weeks.
2 weeks.
Yes, before you say someone has, that would be major depressive disorder. But then for something like dysthymia, which is the minor form, the person will usually be very negative about life. Everything that happens around them is negative. So the person is always negative. The person is never seems to see anything positive about life. Some of these people will be having bad dreams. They'll be dreaming about death. They'll be thinking about suicide. And it goes on for a very long time, for about 2 years. So for dysthymia, it has to go on for 2 years before you say this person has a minor depressive disorder or dysthymia.
Okay, so this 2 years, they start having suicidal thoughts and all of that. So what if before the second year, the person is already dead, the person has already committed suicide, then how do you...
The thing with dysthymia is that most of them don't end up committing suicide compared to those with major depressive disorder. For people with major depressive disorder, like the name says, major depressive disorder, those people have very compelling thoughts to harm themselves, take their lives. They feel like, I'm worthless, I'm hopeless, I'm helpless, so they always want. But for people with dysthymia, they are usually negative and they have the thoughts, but they usually never really go forward to take those actions. But if it is not managed, some of them could actually end up having the dysthymia, and then they will have major depressive disorder as well. And then we'll say they have double depression. So the person is already having dysthymia, which is the minor form, and then the person, because there's no treatment available whatsoever, the person ends up with major depressive disorder as well. So that is, if it gets to that stage, then that person is more likely to commit suicide compared to someone who has just dysthymia.
Okay, so what do you do for a person who has double
Depression.
depression?
So for people with double depression, usually their treatment is a little bit complicated because it's like you have to deal with a major depressive disorder. And as you are dealing with that one, you know that the minor one too is still there that you have to be handling. So you may have to do maybe combination therapy, like giving them drugs. Some of them may also need cognitive behavior therapy, which will help them get rid of the negative thoughts and all that. So their treatments are usually a bit more complicated compared to people with just major depressive disorder or dysthymia alone.
So where does the psychiatrist or clinical psychologist come in?
Yes. So for the psychologists are supposed to come in very early. Unfortunately, in our part of the world, and even in the whole world, so many people go undiagnosed. And then the funny thing about depression is that sometimes some people may not be so sad. Some of them may not have the common symptoms that we've mentioned earlier. Some of them may have actually physical symptoms. Some of them may have headache, stomach pain, body ache. They'll go to the hospital, the doctors will run every test and everything is fine. But then, the bad thing that some of the doctors will do is that they forget that the human being is actually a whole being having physical health and a mental health. So if the person has come and the person's physical health is okay, then you should actually think about the person's mental health being a possible cause of the person's symptoms. But most doctors tend to ignore the mental aspect. So the patient comes, then you tell the person, oh, we've done a lot of tests, everything is okay, so let me just give you some painkillers, and then the person goes home. But if the doctor had asked the person, sometimes ask the person, do you feel sad? Do you have thoughts of harming yourself? Some of the patients will actually come out and tell you, the doctor, that I have these thoughts. Then that doctor, the physician, will have to now refer the person to a psychologist. However, usually the doctors fail to, do that. And so at the end of the day, most of the cases go undiagnosed. And then because of the way society is, the stigma is so much that people with mental illnesses do not want to go to psychologists because they think people will say they are mad. That's the unfortunate part. But the psychologists are actually supposed to come in very early, at the early stages where the thing has not escalated. And then if they come in early, depression and most mental health disorders are very, very treatable. People can actually live normal lives if they get good treatment. However, most psychologists come in very late, when the person has already, gotten to a late stage of the disease, or the person has already committed suicide before we find out that, oh, this person was even depressed.
So what exactly, maybe people need to know what exactly the psychologists do when they go to them.
So when you go to the psychologist, the psychologists are actually very nice people. When you go to them, they would first ask you, how you feel, the symptoms that you have. They'll mention some of the symptoms and find out if those symptoms are present. To help them with the diagnosis, they'll do some lab tests. Like we mentioned, some neurotransmitters are sometimes depleted. So they'll do the lab test to see if the neurotransmitters are depleted. Then they would know that, okay, then you are probably having depression. And then based on your symptoms, they will decide whether it is major or it is minor depressive disorder. And then they can actually take it from there, help you, give you treatment. There are drugs available for depression. If the drugs are not working, there's cognitive behavior therapy, there's ECT or electroconvulsive. There's a lot of treatment for depression actually. So the psychologists, when you go to see them, are actually supposed to help you with first your diagnosis. They're also supposed to help you with your treatment or the management of your condition.
Okay, thank you, Esther. So this topic is very broad. Very. If we start, we wouldn't end.